Okay, so this will be the prepping for a Betadine scrub and paint. Usually when you want to do a Betadine scrub and paint, you'll grab a Betadine scrub and paint prep tray. In general, it will have the Betadine scrub and paint included inside here. If not, you could grab just a prep tray that doesn't have the agents in it, and you might have the bottles that come separately. Remember that the paint in general has a green label that looks similar to this or like this, depending on the company. And then the scrub is always going to have an orange or a yellowish label on it in general. Of course, they look slightly different depending on who manufactures them. But you're going to open it up, take off the dust cover, get rid of that. Again, it's going to be envelope wrapped just like a gown. Open it up on a flat surface, the flap away from you, the two flaps on the side, and then the flap towards you last. Okay, this one happens to have gloves on the inside. If you choose to use those, you can. They are a one size fits all, but again, remember you're going to pick them up and move them to a separate surface to be able to open glove from, or you can open your own size of gloves as well. Hold back the edges of the wrapper so that they don't come back and contaminate the gloves. On the first glove, make sure that you grab on the inside of the glove, making sure that you don't touch the outside sterile portion. Slide the glove on, pull the cuff back, making sure that you only touch on the inside. On the second glove, make sure that you only touch on the outside, protecting your hand inside that cuff, and then slide that glove on. If the cuff is folded back, don't mess with it because you don't want to make sure, or you want to make sure that you don't contaminate your gloves. We have a couple of towels here that are included inside the prep tray. Two of them we're going to use to dry with. Two we're going to use to tuck at the sides of the patient. So if you remember from when we learned about draping a patient from bedside to bedside, when we were going to have an incision that goes bedside to bedside with universal drapes, we took the towels and we draped them back over our hands so that our hands were protected so that they didn't get contaminated. We're going to do the same type of thing here where we take and we hold the towel and we protect our hands so that we can take and shove them underneath the sides of the patient so that our hands are protected from any of those unsterile areas. So these are going to prevent me from contaminating my gloves as I prep out to the sides of the patient, and also prevent the prep solution from pooling at the sides of the patient, which can cause a fire hazard and also can be irritating to the patient's skin. The other two I will use for drying later on, so I just want to place those behind. So I have my prep agents inside here. So again, the paint is green. The scrub is going to be an orange or a yellowish color. So inside here, you're going to have some cotton tip applicators and some scrub sponges. So I'm going to go ahead and pour my scrub onto my scrub sponges, my paint onto my paint sticks. And the first thing I want to do for an abdominal prep is prep the umbilicus. Dip a couple of your cotton tip applicators inside the scrub, and then we're going to prep the umbilicus. Remember, the umbilicus is contaminated. Usually we prep contaminated areas last, but because it's the center of the prepped area, we always prep it first so that it's not going to run out over the other prepped area. So make sure you don't take these contaminated items and put them back into your prep tray. Get rid of them, throw them in the trash. All right, so what we'll do, some trays will come with 6 sponges, so you can grab 2 of them. You know, this one happens to have 3 sponges, so you can just grab 1, or you can grab a couple at a time. It just depends on how long your prep is going to last. You know, Betadine preps, Betadine scrub and paint can last anywhere from 3 to 5 minutes, possibly 10 minutes for a total joint. It just depends on the type of case and the surgeon preference. But each of the preps are always going to start at the incision site. You'll scrub that area first, and we always spend the most time at that area because that's the area where it's most critical that we get rid of the most microbes. And then we just start proceeding out to the periphery. So again, it just depends on surgeon preference and the type of procedure as to how long this prep lasts. If you just work outward in circular motions or squares, however you want to think about it, just proceeding from the middle outward towards the periphery, never coming back once you get out to the periphery, always going from most sterile to least sterile. Okay, once you get to the periphery, get rid of these. Don't put them back into your tray. Again, you would grab more sponges then. Make sure you wring them out so you're not going to have excess running down the sides of your patient. Again, start at the incision site and continue to work your way outward towards the periphery. Once your designated time has lapsed, then you'll get rid of your sponges and dry off the area. So when you open up these towels, make sure that you watch out so that they don't touch any contaminated areas. So open them up, make sure you hold them away from your scrubs, hold them away from anything else that's contaminated. Lay them out over the prepped area, pat them down so it soaks up the bubbles. And then make sure any of these edges where they may have touched the contaminated areas, make sure that you pull this off so that you don't bring those up so that they touch the clean area. Make sure that you pull it off and back so you're not going to contaminate. And then get rid of this. If you need to dry again, you just grab a second towel, open it up again, making sure that you avoid any type of contamination, and lay it out over that prepped area. If you're going to do a paint as well with the scrub, take a paint stick, dip it in your Betadine paint. Again, wring out some of the excess so it's not going to be running down the sides of your patient. And then again, we start at the incision site, and you're just going to paint a thin layer. Again, in circles or squares, however you want to think about it, outward towards the periphery. Now the paint we don't dry off, but it does need to be dry before you put the drapes on. And if you miss a spot, just grab another paint stick. So if I missed a spot that was closer up to the incision site, I would just grab another paint stick and then repaint that area. Because once you come out to the periphery, you can't come back up closer to the incision.